In first aid, there are 5 main vital signs of the body, commonly referred to as the signs of life. Number 1, level of response or level of consciousness is a person's ability to respond, such as verbal communication and purposeful movement of their limbs. Number 2, breathing, consisting of the breathing rate and the quality of their breathing. Number 3, pulse, consisting of the pulse rate and the strength of the pulse. Number 4, colour, which is normally pinkish around the lips, but may be blue as a result of a pre-existing medical condition. And finally, temperature, which ranges from 36.5 to 37.5 degrees Celsius. All of these vital signs of the body are subject to change depending on the age of your child and any pre-existing medical conditions, and parents, guardians and carers should make a note of their own child's normal vital signs so that they can identify any changes and take immediate action. If you find your baby or child is unwell, it is important that you know what to do so that they have the best chance of survival. If something has happened to your baby or child, you will carry out what is known as the primary survey, which will determine the 5 vital signs of the body, which are also known as the signs of life. This systematic yet easy to remember procedure ensures that you do not miss any life-threatening injuries or medical conditions, and is easily remembered by the acronym Dr. ABC. D is for danger, R for response, A for airway, B for breathing, and C for circulation. So the first check of the primary survey is checking for danger. So you're looking for any potential hazards around your child, such as electrical cables, fire, liquids, or chemicals. And this is to prevent any harm from coming to yourself or preventing any further harm from coming to your child. Once you've checked for any danger and removed any potential hazards, you're now going to check for a response. So start by calling the baby's name. Hello, Annie. Annie, can you hear me? Hello? No response. Then gently flick the feet and see if you can get a response. There's no response, so you're then going to check the airway. So one hand on the forehead and gently open the mouth with one finger on the chin, looking inside the mouth to see if there's any foreign objects or debris. And if there is, gently scoop out, but without doing any blind finger sweeps. If it's clear, if the airway is now clear, one finger underneath the chin and tilt the head very gently back to open the airway. You're now going to check for breathing, so put your ear next to the baby's mouth, one hand on the tummy and looking down the baby's chest. You're going to check for breathing for at least 10 seconds and you're looking to see if the breathing is present and if it's regular and effortless. So that's good, so the baby is breathing normally. We can then move on to the next step, which is looking around the baby for signs of circulation, looking at the tips of the fingers and the toes for any discoloration, looking at the lips to see if they're a nice pinky colour. What we don't want to see is blue tinges, unless that is a normal condition of your baby. And then you're finally looking for any other obvious signs of severe bleeding, which, if present, you will treat with a wound pad or a wound dressing immediately. If you find that your baby is breathing normally and there are no obvious signs of bleeding, then you're going to roll your baby into the recovery position by doing the following procedure. Placing your baby in the recovery position, start by controlling their head, lifting in from underneath and bringing them gently towards you, controlling their head, making sure that you bring them all the way over so that they're facing downward, their nose is pointing down, and that their airway is clear so that any vomit or liquid can drain out of their mouth. So once you have your baby in the recovery position, keep monitoring their breathing, and should they stop breathing, call 999 or 112 and request for an ambulance and start CPR.